Let's say a patient calls and says, "I have a toothache and I need to get in right away." In this profession, we tend to be empathetic, which is of course very important. But before you tell the patient to come on in and potentially mess up your schedule, be sure to determine whether or not it's a true emergency. If it turns out that the tooth broke last night or there's swelling, that qualifies as an emergency. Otherwise, you'll want to have an emergency triage form within arm's reach. We've included one with this video that you can use in these situations. It's very similar to a new patient form, and if this is a first-time caller, you're going to want to use both forms. The emergency patient triage form helps you to pinpoint the nature and severity of the situation. Once you get their name and phone number, it's time to start asking questions, beginning with which tooth it is. "Mr. Jones, is it on the right or left side? And on the top or the bottom? Can you use your tongue or finger to count how many teeth it is from the back of your mouth?" Ask about the pain or sensitivity. Is it sensitive to hot or cold? Does it hurt when you bite down? Is it keeping you up at night? Now, it's important to find out how long he's been in discomfort. If Mr. Jones tells you it's been bothering him for a few weeks, he can probably wait until you have an emergency slot in your schedule. Ask if he's recently had dental work done, and remember to speak his language. Can you tell me if there is a silver filling on that tooth? Do you remember having any work done or a crown placed on that tooth? With the answers to those questions, decide whether it's a true emergency and guide him into the appropriate slot in your schedule while setting some expectations for him. "Mr. Jones, we have a full schedule, but I understand you are in pain. So if you can get here at 12 o'clock today, we're going to work you in. There may be a little waiting time, but our goal is to get you comfortable so you can get some rest tonight." Remember not to promise you will solve the problem. Say instead, "Typically what we'll do is x-ray that tooth and then the doctor will do an exam. It is possible that we won't treat that tooth today if a larger procedure is necessary, but we will get you comfortable and the soonest possible appointment to get that tooth fixed." If the patient ultimately says, "12 o'clock doesn't really work for me," well, he's kind of done the triaging for you. Now, a couple of housekeeping points about emergency time. First, you should have a certain number of emergency slots blocked in your schedule based on how many emergencies you see every week. Also remember, these appointments often run long, so consider placing these slots either mid-morning so you don't run into lunch, or right after lunch so everyone isn't staying late. Remember, all toothaches are not created equal. Always use a triage form to make sure it's a true emergency.